Hello, Harry Brownlow, shoulder and elbow specialist. Today I want to talk about issues regarding consent for elbow arthroscopy. Now, there may be lots of different reasons why you're having an elbow arthroscopy, and therefore this video will necessarily be quite broad, and it's really important that you have a full and frank discussion with your surgeon, understanding the intricacies of your operation and your particular needs. But in terms of broad issues, I suppose the first one to consider is the fact that your operation may not be as successful as you would like. So for example, if you're having the operation for tennis elbow, then we know there's a failure rate. It's probably about 20%. So 80% of people get better after the operation, perhaps 20% don't. And if it doesn't get better, that's very disappointing, but the good thing about tennis elbow is it tends to get better in time anyway. So while it's hugely frustrating having gone through the rigmarole of having an operation and it not working, there is at least a big light at the end of the tunnel that it will still get better, because that's what tennis elbow does. If, however, you're having an operation because you've got arthritis in your elbow, then an elbow arthroscopy is never going to cure the underlying arthritis. So it's really important that you understand that the expectations of having this surgery are trying to improve your pain to some degree, to stop your elbow from locking, but it won't improve your range of movement one iota if I do it for you. So it's really crucial that you understand what's to be expected from the operation, so that you don't come away feeling like it might have been a failure. So failure is the first thing. The next thing is infection. Of course, when we introduce an instrument into any part of your body, there is a small risk of introducing infection with it. Thankfully, because it's done with keyhole surgery, with water rushing through your elbow as the surgery is being done, there's very little opportunity for organisms to settle into the elbow joint, and therefore the risk of infection is very small indeed. The next thing is stiffness. Whenever we meddle, if I can use that phrase, with a joint, it may respond by going stiff, and the elbow is no different. So you might have a fairly straightforward operation for whatever your problem is, and rather than just easily getting better, the elbow becomes quite stiff for a while. That's always just a temporary hiccup. While it's fantastically frustrating, it does get better with time and physio, and shouldn't be a cause of any long-term issues. Now, the thing that worries us most about operating around the elbow is damage to the nerves. And this is a potentially very serious and a very real problem. Nerve injuries can happen with elbow arthroscopy, despite everyone doing everything right and paying huge care and heed to the anatomy. The anatomy might become very distorted by the pathology. There are a series of big nerves that cross the elbow, and we know where they are, and we make every effort to protect the nerves while we do the surgery. But sometimes the nerves do get injured. Now, thankfully, normally, if a nerve has been injured, it's usually only a temporary thing. If it's been injured by a local anaesthetic injection, for example, it'll be better within just a few days. If the nerve's been bruised but not cut, it should slowly come back to life over several weeks and months. But if the nerve has been inadvertently cut, then you will have a permanent nerve injury, and that can be absolutely devastating. It might mean that you can never make a proper fist of your hand, or you might never be able to do your particular work again. So while it is very uncommon, when it happens, it can be very serious, and therefore it's something that you have to give due and proper consideration to, and to discuss very specifically with your surgeon before you embark on the surgery. I hope that helps. I hope that hasn't put you off too much. And just remember that in the vast majority of cases, everything goes without any complication, and it's a great success. Thank you.